France. So I have taken interest in these subjects in general, otherwise also. And then I was Pakistan's economic minister to Brussels in EU, and there we got free market access in exchange of our promise to genuinely implement the UN conventions, rights conventions. There are many which we have signed. So that brought me in closer contact with the rights landscape in Pakistan. So after I retired, I did not join. Went back to the government and established this think tank called Social Protection Resource Center, and we work on social policy issues with a big focus on disability and elderly. Right now, for the last now 20 months, we have a pro bono engagement going on with 5 federal government ministries to make Islamabad a better place for the disabled and elderly to live. The format is that we identified the sticky problems that both of these populations have, and then sat with Ministry of Health, with Ministry of Human Rights, with Safdar Sohail, with Benefit Income Support Program, with Pakistan Bureau of Statistics, with Ministry of Education, IT, and we, over the past 1.5 years, 20 months, I told them that, look, I don't need any money, nor would I take this project to a third donor, which usually happens. All I need is that you spare your own experts within the government system to become a part of a research and development group, which we established. For example, Ministry of Health, we asked them to ask National Institute of Rehabilitation Medicine, IIPS, Health Services Academy, to be Islamabad Health Regulatory Authority to be part of our research and development group. Likewise, in Ministry of Human Rights, their CRPD, which is a Council for the Rights of Protection of Rights of Disability, they are with us. Similarly, BISP also. So what we have done over the past 20 months is that we have digitized the data of all the disabled people, which was manual in the term that the people who have been given disability certificates, and we have made them an MIS, which is working as a backbone of an integrated social welfare system for Islamabad. The first priority is disabled. There we have shifted the medical assessment board from Chak Shahzad, where no public transport was going, to Niram, which is well served. This whole edifice is established on the vision that government should provide proactive service which is disability sensitive, and they should do it efficiently. So if there would be time, we would talk more about that. So that integrated social welfare system is in place now, under development by NITB. It would be connected with other service providers. We have been asked by BISP to propose packages for the disabled and elderly, which we have done. We are working with Safdar Sohail program to, they don't have anything on disability except prosthetics. So we are working with them also on that. And due to our work, you can say, or to benefit from the research and development group, the Ministry of Human Rights has established a grievance redressal committee, Elderly Grievance Redressal Committee, which is stipulated under the Islamabad Senior Citizen Act 2021 that Madam talked about. So I'm the chair of the committee, and Dr. Asghar Zaidi is one of the members, and then Dr. Rizwan Taj, a psychiatrist, is also a member of that committee, which is doing its work. We have already submitted a proposal to the ministry about the policy gaps and recommendations gaps, and I'll take a little longer to talk about that. So with this background, I'm particularly happy that your forum would also make a contribution to the common cause of improving the elderly care. We are working in Islamabad, but we hope that our model would be replicated in other places also. Now, what is the major problem with the Islamabad Senior Citizen Act? Madam was kind in saying that it's a better act. I would not say anything on that because the potential is far from realized. So I'll just hold my judgment. Number one, the basic issue when it comes to elderly care in Pakistan is that of vision. Now, are we talking more about rights or are we talking about comprehensive care? Now, we usually copy the UN conventions, and the countries which are in the forefront of these UN conventions, like let's say Europeans, they do not have an issue with the basic provision of care in terms of health, let's say, or social security coverage. Now, in their case, the question does not arise that an elderly would be without any financial or health protection. Now, as they do not have an issue with the financial protection of elderly or health, they talk more about the rights. Now, in our case, in our own understanding, rights are important. Nobody should be evicted from the property. If you give property to the children and they turn against you, you can restitute that. So rights are important in terms of inheritance, in terms of abandonment. Dignity is rather vague in general, but I would say that in our case, the major problem is that of health. And that brings me to the second issue of visioning the old age in Pakistan. You asked Dr. Zaidi a question that who is old? Now, this is an extremely important question. He rightly responded that it's 60 for the government, 65 in terms of availing many benefits that the government gives, which are given in Islamabad Senior Citizen Act also. But if you look at another data point, which is the healthy life expectancy. Now, our average, the life expectancy at birth is slightly more than 66. It's around 67. But the real significance is that of the data of the healthy life expectancy. Now, the disease cluster which hits the Japanese at the age of 75 hits us at the age of 55. Now, our healthy life expectancy is around 57. And if you disaggregate this data by socioeconomic status and women, the poor people, for them, life expectancy is early 50s, and for the women in the poor household, it's late 40s. Now, what does it mean? Long years of disability and disease due to lower life expectancy. Life expectancy, healthy life expectancy, that's the right word. Now, how have we arrived here? By not providing adequate social protection to our population in general, particularly health, which basically means that our populations suffer due to ill health, and health becomes a major vector for bringing down the healthy life expectancy. So there, our labor cannot work in 50s. We talk so much about the demographic dividend, but we are spoiling the demographic dividend when our people cannot work in 50s, and a household spends more than it earns. This is a serious data point. In the poorer households, they spend more than they earn on health. It's 100% plus their primary income. So in that sense, in our visions, while drafting the Senior Citizen Acts, we have all those handicaps that Madam has pointed out, that they are designed by people who have different kind of objectives. But we should be clear that when it comes to the older population, care is the primary focus that we should have. Now, what the approach that we are suggesting is that taking the lifespan approach, what we have observed is that the worst in the elderly population are the people who either have chronic diseases or have disability. Now, in all over the world, the severe cases of disability are taken care by the state. If you have dementia-driven disability in a poorer household, there is absolutely no way that they can take care of that, or hire a nurse or spare one person to take care of that. Now, in so many countries, there is a concept of uh, cash for care, because if one person is leaving her job and is attending the elderly, that also has a cost. Our old age laws have little on prevention as such. Now, getting quickly to the policy gaps, we Senior Citizen Act 2021 has given kind of policies. Now, but when we look at the policy responses that they have given to the challenge, without, I would say, quantifying the social protection needs of the elderly, they are just copied from somewhere. Madam has amply highlighted the significance or bad intentions of giving funds a central importance. And then the other policy response is that they say that we would make Daru Shafkat. That's the second policy intervention that the Act stipulates. And then they say that we would make a Senior Citizen Act, a Senior Citizen Card. And the fourth one is that they say that we would make a Grievance Redressal Committee. Now, what is the status of implementation? Fund is not yet established because the council has not met since long. The council met, I think, in September 2023. After that, the council has not yet met. One good thing, or whatever thing that council did in September 2023, was to establish this Grievance Redressal Committee. But as the rules of the council are not yet formulated, the rules of the Elderly Grievance Redressal Committee are also not made. So in the meantime, we have been working on the policy side, but we are waiting for the rules to be made, because one of the major policy response of the Senior Citizen Act is to stipulate heavy penalties for medical negligence of the elderly in the hospitals. But you need rules for that, which are not yet made. Daru Shafkat is nowhere to be seen because fund is not there. So Daru Shafkat is not there. That is still a very large subject, that what kind of shelters do we need, that is there. Citizen cards, not done yet. And we are still talking that when we have CNIC, do we really need a new card? I can later on share the list of benefits that should come through the card, but they have kind of linked those with the card. So the implementation status of Senior Citizen Act needs much more to be desired. But I would say, agreeing with Madam, that the problem is basically with design. When you design things on fashions, this is what happens. Now, what is the way forward? That's the last part of my presentation. The way we look at is that given our resource constraints and lack of will, lack of clarity, and fragmentation that we have done, we are stuck in a bad situation where, if we are able to provide for the worst cases, worst vulnerability among elderly, that would be a big thing. Now, there in that case, what we are suggesting to the government, that as we do not have a comprehensive social security, so our elderly face acute financial vulnerability and health vulnerability. Now, Punjab has started giving some little stipend to the elderly, which is a good thing that they have done. But otherwise, what we have to rethink is that BISP is using still family as a major unit of analysis to give the Benazir Kafalat. Now, you give it to the household, 3,500 roughly at present per month. And given the inflation which has taken place, they say that this is poverty reducing measure. In 3,500 rupees, you cannot put even food for an average household on the table for 10 days. So forget about the poverty. And then with this 3,500, you cannot adequately take care of the food. But how much would you spend on the elderly? How much would you spend if you have a disabled in the family? And how much would you spend on the children, let's say girl children or other children? They have this Wasila facility, that Wasila Talim would go for the, let's say, children. Now they have started giving stipends for the people who have a disability certificate, but their percentage is very low, because there again they have done a thing which they should not have done, that they've linked the availability of stipend to the holders of special CNIC, which is not even 1%. And we should also realize that usually people go to get the disability certificate to get the jobs. So we are stuck with the 1981 Act, which basically was aimed at giving more employment to the people who are disabled but can work. Most of our elderly who are disabled by any definition do not have the disability certificate to make them avail any of the facilities which are there. Now, the facilities which they have provided a list in the Senior Citizen Act is long. I'll just talk about the one which is about the health. So they say that you can go and avail health facility from any government entity, but we all know that what happens in the government hospitals. Now, what we are suggesting to the government is that if we focus on the older people who are suffering from severe disability, we should combine the efforts of Sehat Sahulat program and Benazir Income Support program, and we should start cash for care program, both for home care as well as for the care provided by, let's say, privately built shelter houses or by NGOs. We gave 15,000 rupees to a disabled who needs assisted living round the clock. Assisted living round the clock is the defining element. And as everybody cannot take care of such cases, we should have the option of houses, whatever you call them. And there in those houses, you should have the hospice care, you should have the health care, therapies, and some social space. According to our own survey, 32% of the older people do not have access to medicine, and 30% people do not have the access to nutritious food. And 28% of the parents of the older people in Pakistan are living alone. And the single old living alone in Karachi, according to our data, is 8%. So there we have to come up with a solution that even if the care provider has to go away or is really psychologically under pressure, so the home care provision could shift. The Buzurg can go to the shelter, then come back and make it more flexible. So there, if we adopt this kind of a scheme, then we have proposed the establishment of counseling services. In Maharashtra, India, for example, the police has been asked to visit every household which has elderly to check on their state, to check about the violence, about the rights, about all those things. So we need to activate newly designed social welfare services, which bring in the voluntary services or universities or internees for that. So that is the minimum that we should do, that we should define, quantify, the population segment which is the responsibility of the government, and then put in place a proper scheme to take care of them. I think I should stop here, and if there are any questions, the last thing I would like to do is that Army is experimenting with a model, or in Pindi, I'm told that they take 50% of your pension, and in exchange of that 50%, they take comprehensive care of you, including food. If you're sick, they provide a space, and you can use 50% of your pension yourself. Now, there are models available. There are many insurance models available. Our middle class is suffering due to the heavy care burden of the elderly, but we are not even able to take care of the worst cases of need. What to talk about the middle class? Thank you.